A recent study has shown that healthy teeth not only look good, they can reduce the risk of heart attack and stroke. But more than a few people don't get their gums and teeth checked out because, frankly, it's a pain. But a new procedure is taking that pain away. It's called the Florida Probe, and Dr. Debra King is the first in Atlanta to use it. She's here this morning to tell us how it works. We're talking about periodontal disease, and you've brought Debbie Chapman, your hygienist, with you, and then there's our victim.
Thanks. I'm going to get my teeth probed, and I'm over there eating chocolate and vegetables.
Okay.
So.
Well, let's first of all talk about periodontal disease. What is it exactly?
Periodontal disease is a condition of the gum and the tissue, and what we see is a loss of connective tissue, loss of the bone that actually holds the teeth in the jaw, and infectious pockets around the teeth.
Oh.
And what's interesting is 85% of adults in the United States have some form of this disease.
So they really need to get looked at quickly.
Absolutely.
So, but we had that study that we heard about, the difference between, the Florida Probe is waking up there, but the difference that having healthy teeth can make in heart attack and stroke?
Right. There have been several recent studies that link periodontal disease to heart disease and other ailments of the body. And some of the statistics are alarming. For instance, men under the age of 50 who have periodontal disease have double the risk of coronary heart disease than a man under 50 who does not have periodontal disease.
Wow.
And also stroke victims. We know that stroke is caused by fatty deposits on the carotid artery. Those fatty deposits contain 70% bacteria, and 40% of that comes directly from the mouth. Also, women who have periodontal disease have 8 times more likely to have preterm babies than women that don't have periodontal disease.
More the reason to get your teeth checked out right away.
Absolutely.
Which brings us to the Florida Probe, which is what?
It's still coming up, I think.
Okay, but it's supposed to be less pain, because going into the periodontist, I'm sorry to say, it's been a painful experience because of that manual probe that just kind of pokes in there.
Right. This is the manual probe, and most dentists still use this, including myself occasionally. But the difference with this is that operator to operator would have different pressure, so you can get different readings. So it's not as accurate as the Florida Probe. The Florida Probe has a constant pressure, and so it's good. So it is constant no matter whether I use it or Debbie uses it or anyone. We can get very constant, reproducible results. And then we can also use the charting that comes from the...
Well, let's take a look at that while this is still warming up a little bit. And this is the result of using the Florida Probe. And the red shows what?
The red shows areas that are problems, unhealthy areas where there's actually bone loss or bleeding or infection.
Okay, and the black is healthy.
And is healthy areas, right.
So you need treatment like right away with this sort of problem.
Absolutely, and the nice thing about the Florida Probe is it can be site-specific, where if you could have healthy areas in most of your mouth, but in the back there could be some areas of periodontal disease, and this indicates it to us, so we can be site-specific and just deal with those areas.
Okay, are we going to be able to probe, Tom?
We're having a problem probing, but this is what we're looking at right here. This is the wand, right?
Okay.
Now how does this work here?
Go ahead.
How does that work?
How this works is it goes down and it will measure. I'll hold it onto there.
Okay.
It'll go down and measure the space where your dental floss is placed, and it determines whether or not your tissues are healthy or diseased.
And that's about the length, as much pressure as you'd put on just a little dab? And
you cannot press too hard. It's very comfortable with the patients. All the patients love it. And it's you cannot press harder. Unlike the manual probe, it was all in our wrists and our hands.
So the computer varies
automatically.
All that.
You cannot press too hard, which makes it very comfortable.
Okay, well, if you'd like more information on the Florida Probe, Tom got out of this one. You can reach Dr. Debra King in her Roswell Road office at 404-847-9711. Dr. King, thank you so much for being with us. Debbie, thank you very much.
The perils of live TV.
It does happen.
We'll be right back.